and the family have a very strong role to play, because it's a really tough journey for the women.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle, a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we will be discussing about a topic that is deeply personal, often painful, yet rarely talked about openly: recurrent pregnancy loss. And the doctor joining us today is Dr. RADHIKA Telugu, the specialist gynecologist from Al Hilal Hospital, Riffa branch. So, Doctor, welcome to the show.
Thank you.
Doctor, our topic today is recurrent pregnancy loss. From the medical standpoint, how do you describe recurrent pregnancy loss?
This is a very deep subject. There's a lot to discuss about, but I would try to cut it short and highlight the important points, like where the women has to seek medical attention, what exactly is a recurrent pregnancy loss. So, if we divide the pregnancy into 3 halves, like 9 months of pregnancy, the first 3 months is first trimester, second 3 months is second trimester, and the last is the third trimester. So, if the women loses pregnancies consecutively in the first trimester, that term is recurrent pregnancy loss. So, if the woman has already one child, then a miscarriage, then child, then miscarriage, it is not a recurrent pregnancy loss. So, women should have 3 losses consecutively. That is a recurrent pregnancy loss.
How common is this condition, and when should a woman seek medical advice?
It's not very common. Unlike the sporadic miscarriage, recurrent pregnancy loss is sometimes not uncommon, but it definitely needs a specialist evaluation. So, if a woman has 3 losses consecutively in the first trimester, or if she has one loss in the second trimester, she should go for evaluation to see what exactly is going wrong with her, along with her partner.
Doctor, what are the common causes for this condition, repeated miscarriages?
So the first and the foremost reason would be the increased parental age. Here the parents means both the mother and the father, both have an equal share, but compared to the father, the mother's age adds to the problem more. If the mother age increases more than 45, the risk adds up. So the second cause would be the previous history, like if women has a miscarriage previously, this miscarriages adds upon. So one miscarriage has 11%, other has 27, third one will carry 30%, is the fifth one, and so on and so forth. So number of miscarriages will add up. And the third most important, where we evaluate commonly in our clinics, is the antiphospholipid antibody syndrome. So this APLA screening is of two types, both it is acquired as well as inherited. So the acquired type is usually causing more miscarriages in the women. So this APLA screening have three components in that. The acquired one in particular have lupus anticoagulant, anticardiolipin antibody, and the beta-2 glycoprotein. So these antibodies, what they identify the own women's cell as toxins, and they try to eliminate it. This is the condition called autoantibodies. So the own body cells are identified as foreign cells, and these antibodies keep on attacking them. As a result, this miscarriage happens. So the other one is inherited. Some women will be born with inherited thrombophilias like factor V Leiden mutations and proteinase deficiencies. So these particular women need special attention. And the other causes, like women are born with genetic conditions, and even the father genetic material also contributes. So any genetic condition has to be evaluated. And if we take the pregnancy, so the mother, the fetus, and there's another factor which helps in supporting the pregnancy is the placenta. If there is infections causing any problems in the placenta, the women do have pregnancy losses. And the last is the uterine structure. If the uterus structure, sometimes normally the uterus shape is globular. So in some women there will be developmental defective formation of the uterine shapes. There will be bicornuate uterus, arcuate uterus, there is a septum, there will be wall in between the uterus, or there will be only one horn of the uterus like unicornuate, and so on and so forth. See, these uterine anomalies also causes recurrent miscarriages, but these uterine anomalies, they contribute mostly to the second trimester miscarriages. That is, the pregnancy crosses 3 months and the women miscarriage in the 4th or 5th or 6th months of the pregnancy.
And doctor, what are the tests you suggest for women who experiences repeated miscarriages?
So there will be modifiable risk factors as well as some non-modifiable risk factors. So the modifiable risk factors will be the lifestyle changes. So if the woman is obese, or the woman has pre-existing diabetes, or if she has a thyroid condition where the TSH is elevated more than 4 units, and all these are modifiable risk factors which can be corrected if the woman plans for conception. If the woman comes to us before conception, we can treat her these conditions. If she is her BMI is less than 19 or more than 25, we'll ask her to first correct the BMI before conceiving. And if the diabetes, HbA1c levels are more than 6, we'll ask her to bring her into the normal glycemic state. And euthyroid also, we have to bring her to the euthyroid status, and ask her to cut off ask both the partners, in fact, the mother and the father, if they have any addictions, they should cut off their addictions, they should exercise more, eat a balanced meal. So in this way, we should advise the patient pre-conception before coming to plan a baby. They should do all these corrections. And some women, unfortunately, they do carry this genetic component that is very hard to treat, and these genetic conditions, we advise them to consult a geneticist, clinical geneticist, where he can do further testing and advise what to do if they want to have a healthy pregnancy. And the APLA screening, as I already told, we have to do the APLA screening and do the corrections, and so on and so forth.
And doctor, how important is the male partner's evaluation in recurrent pregnancy loss?
Yes, definitely male also has an equal share in contributing to this problem, because he gives half of the genetic material to the growing gamete, isn't it? So half of the genetic material is carried from the male, so male should also test it for the problem, and he should get his karyotyping tested. If the man has a diabetes, the main problem would be the DNA of the sperm will be fragmented. We call this condition